Yes, Reena, Saini, you can start now.
Okay, sir. Good morning, Mr. Johnson.
Good morning.
Please have a seat.
Thank you very much, nurse.
Okay, how are you doing, Mr. Jones?
Um, yes, actually, nurse, I am very much worried about this problem. I want to know more about this. Can you please help me?
Okay, definitely, I will help you, and you are here to remove your stitches because today is your appointment. Am I right?
Yes, nurse, of course, you are absolutely right.
Yes. Do you have any another concern regarding apart from the carcinoma, squamous cell carcinoma?
Yeah, actually, I have a lot of confusion regarding these things, nurse. I want to know what exactly this is because I don't know anything. The doctor has told something like a squamous cell carcinoma. I think maybe it's another name for skin cancer. I'm a little worried of this term. I don't understand it. Can you please explain me, nurse?
Yes, Mr. Johnson, I do sense your feeling, and definitely I will explain you. First of all, I am going to tell you about the squamous cell carcinoma. It's a type of skin cancer which is caused by a sun exposure and the harmful ultraviolet radiation. So these are some reasons uh, which leads to squamous cell carcinoma. I will reassure you that after the surgery is a very effective treatment for the squamous cell carcinoma. In this surgery, the lesion has been removed from the body and the cancer is unlikely to be spread. And there are no chances of spread another cells from one cells to another cells. So it's a very simple procedure and there is nothing to be worried about it. All right.
Okay, nurse, and I now have a better understanding of what squamous cell carcinoma is. I want to know if I am likely to need more surgery to remove other lesions in the future.
No, your squamous cell carcinoma is very superficial. So this time we have removed your carcinoma and there are no chances. And this time I need to monitor your skin. So could you please tell me, is there any support or you notice any kind of bleeding onto your skin?
No, nurse, there is no pain, no bleeding, no discharge, nothing. I'm fine, I think so, because, okay, because one more thing is I always wear, some sort of, first aid activities. I take care.
Yes, Mr. Johns, I acknowledge your concern as you told me that you wear all the time protective equipment like sunscreen or hats. Definitely, you need to wear all these stuffs because it will prevent the harmful rays. And according to my examination, your skin is very stable and you are out of danger. So don't be worried about this. All right?
Yes, nurse. I always wear a high factor sunscreen, 30 or higher, and I wear a hat when I'm out in the sun. But I think it's too late because the damage has already been done. I spend too much time in the sun in my teenage years.
Yes, Mr. Jones, I know this time you are overwhelmed, but don't worry. Your skin is completely recovered, and you need to just continue with all these kind of equipments. Like you need to wear a hat whenever you are going outside, and you need to apply a sunscreen when you expose to a sun rays. So these are some protective measures which you can continue with this. All right. And do you have any pain after the surgery or any kind of unusual discharge from the skin?
No, nurse, I don't have anything like that. But I am doubtful whether it is time to remove my stitches. I think they should be removed after some more time. Why so
Yes.
hurriedly you are removing these things?
Yes, Mr. Johnson, your question is a very reasonable, and I can understand what you are going through. I will explain you what will be the process. This time we have removed your squamous cell carcinoma from your body, And after the assessment, then a consulted doctor will assess your skin, and he will find that your skin is a very stable, and after the stabilization of your skin, and it's a very natural process that we need to remove your stitches within a 7 to 8 days. All right. So it's a very natural process, and this time your skin is completely healed from the wound. All right, Mr. Jones, is that okay with
Yes.
you?
Yes, yes, nurse,
Yes.
that's fine. And okay, based on what you suggested, okay, your recommendation, I understand it's very important to have the stitches removed. So I'm ready, nurse. I give you my consent.
Oh, thank you, Mr. Jones. Further, I would like to advise you the aftercare. When after the removal of stitches, you need to keep your wound dry, and make sure you don't wet your wounds, and cover it, cover all the time with any cloth, or as I told you before that you, as usual, which are you are using like sunscreen or hat whenever you're going outside. So these are some protective equipment. So just follow these all instructions, and at last but not the least, I need your consultations for the stitches removal. So are you ready for this?
Yes, nurse, I'm ready for that. Thank you very much.
Thank you, Mr. Jones. I appreciate your decision, and thank you for cooperating with me.
Okay, okay, nurse. Thank you once again. Yeah, Reena, Saini, let me give you some feedback. So the thing is, you are taking the name of the patient, Mr. Johnson or whatever it is, you're taking again and again. Don't take too many times. Once you take in the beginning just for introduction, that is enough. Afterwards, Johnson will not change into Robertson or some Wilson or some other name. Okay, so name will be always the same. So you need not repeat the name of the patient time and again. Number two, reduce the pauses and breaks. A number of times you are here and there stopping in between without any valid reason because the flow of speech is missing. Suddenly you get stuck and you pause there and you think, then you start saying. So instead of that one, slow down your pace a little and maintain the fluency, whatever it is. Then maintain the flow of speech. That is what I told you. You have to be, fluency should be there. And the flow of speech should be not fast, not slow. It should be average at least. The next one, confidence level is very high. There is no problem with your confidence. You are doing excellently well. And then avoid unnecessary sounds. So what is this sounds? Sounds are like that one sounds. Avoid them as far as possible. Okay. Then next one is, you said all these kinds of, all these kinds of, all these kind of, all these kind of. It's all these kinds of, not kind of. When you say all, it is more than one. When you say these, means it is more than one. This, these, one, all. So one is singular, all is plural. So for plural, you have to use kinds, not kind. You are saying all, one plural, these, another plural, but you are saying kind. Kind is, you cannot use kind. All these kinds of. So that's one mistake you have made. And use advanced vocabulary. C1 and C2, try to use quality vocabulary that will enhance your style. Then equipments, you told. Equipments. It is equipment, not equipments. It is equipment. Then subject knowledge is excellent. Subject knowledge, you have excellent subject knowledge. Then fluency is well maintained. Okay, flow of thought is different and fluency is different. Okay, fluency is well maintained. Subject knowledge, you have a lot of knowledge you have what regarding the subject, what you have to do, when you have to do, how do you have to do, all these things. Okay, so you're doing fine. That's no problem. Fluency is well maintained. Only the problem is with your accuracy. You have to improve on your accuracy. Work on your accuracy. Focus how to make them correct. Is that clear?
Yes, sir, clear.
So did you get any new things? What did you learn from this speaking session?
Sir, from the last 2 3 days, I repeat the patient name, and today you pointed me.
Are you getting the quality you are expecting? You are a regular student. Are you getting the quality you are expecting from me?
Yes, sir.
Okay, fine. Thank you. You can leave now and you can focus on the other writing and reading and listening tasks. Okay.
Okay, sir. Thank you so
Right. In the
much.
evening, I'll give you another speaking session because your exam is close by. Right.
Okay, sir.
Your video is already